Madam President, colleagues all, Guyana joins this Assembly in extending condolences to the government and people of the United Kingdom on the loss of lives in the horrific act of terror on young people in Manchester. Our prayers are with them. Madam President, let me extend congratulations on your election to the presidency of this World Health Assembly. Congratulations also extended to Dr. Trudus Adhanom Ghebreyesus on his election as Director General, and also sincere thanks to the outgoing Director General, Dr. Margaret Chan, on her outstanding leadership of the WHO over the last decade. I wish to thank the Executive Board and members of this prestigious Assembly for selecting the theme of this year's deliberations, building better systems for health in the age of sustainable development. Under this theme, we have the unique opportunity to address some of the most challenging global health issues and decide on appropriate solutions that will ensure that our world is safer, healthier, and responsive to all the needs of its inhabitants with dignity. For Guyana, the challenges to health are clearly recognized as those related to the non-communicable diseases, global security threats, and access by people to all the essential services. I have no doubt, Madam President, that this Assembly will facilitate a clear path to good health and well-being by building consensus on the acceleration of the NCD goals by the 2014 review meeting of the political declaration of the 2011 UN high-level meeting, WHO goals and targets, particularly with regards to the marketing of harmful substances, tobacco, alcohol, unhealthy fatty, salty, and sugary foods and beverages, and the limited access to prevention and treatment technologies, including diagnostics, medicines, screening measures, and risk factor mitigation. The global food, beverage, medical technology, and pharmaceutical industries have become so powerful that small island developing states, SIDS, and countries with low-lying coastal zone like mine, with limited regulatory and monetary capacity, cannot effectively impact on the negative effects of activities of these giants. Our ability to negotiate better solutions for healthy foods and beverages, high quality, effective and safe medicines and other medical technologies, and to stimulate the promotion of health and wellness by the gigantic global advertising networks is minuscule as individual SIDS, but more impactful when voiced together here in this Assembly. We have seen the increase in extreme weather with the propagation of insect vectors, spurring outbreaks like chikungunya, Zika, and yellow fever. But we have also seen the rapid access to health resources and technologies with timely interventions and solutions, moving at lightning speed across our world to where they are needed. The responses to the last Ebola outbreak in Africa and the more recent Zika epidemic in the Americas, Guyana and across the region are good examples of this, with both outbreaks now under control in most places. Guyana, over the last 50 years, Madam Chair, made significant strides in elimination of vaccine-preventable diseases, such as polio and measles, with almost 100% coverage of all vulnerable population. Despite the challenges of the geography and terrain in our remote areas, we continue to maintain high coverage with support from all our partners. Stronger systems to monitor health risks globally and particularly access the impact of climate change on their occurrence are urgently needed. In concluding, Madam Chair, collectively I feel that this Assembly and that our new Director General, Dr. Theodorus, and his team can motivate strong global action on health with the greatest local impact on sustainable development as we work together and share best practices, innovations, and solutions that can enhance the health and well-being of all of our peoples. I thank you.
Thank you for your contribution.